Hi everyone, this is Cindy Jean-Baptiste, and today I am going to talk to you about a blog that I've written on health equity. This is a presentation about health equity, and if you want to read my blog, I will give you the link. It is on health equity, so this is a health equity simplified, and the target audience is basically those who have an idea of health but don't really understand everything that goes towards making us healthy. The blog, which or this presentation, can also be a resource for health professionals and educators who give presentations to target audience. Those who don't really understand what health equity is. For example, teachers of school children, adult literacy programs, and other program officials. For instance, welfare programs. Health is more than just not being sick, and I'll talk more about it and tie it back to health equity. What does it mean to be healthy? Health is defined by the World Health Organization as a state of being completely physically, socially, and mentally okay. So not just not having a disease, you have to be completely okay mentally, physically, and socially. A lot of times when we talk about health, we think, oh, you know what, I'm not having a headache, my asthma is in control, I'm healthy. But is that what health is all about? Lately, we've been hearing about mental health. This is a growing concern, growing topic. So not having problems such as anxiety, bipolar is a mental disease, clinical unhappiness or other illnesses that may require diagnosis. Having a poor mental health day without a diagnosis on record, does that mean I'm healthy? Or having somebody who's diagnosed with, for example, schizophrenia, which is a mental disease, but there's no other health issues. Are they unhealthy? So there's a lot of conundrum when it comes to health. And what about our social health? A homeless person with no physical or even a mental issue, are they socially healthy? What about an elderly individual who's all by themselves, nobody's checking on them? They're not physically sick, but can we say that they're socially healthy? So we have a lot of good examples, and that's why World Health Organization says that complete physical, social, and mental well-being, and not just the state of being sick. So, you come to think of it, for example, in my case, I didn't see a doctor these past year, but there are days that I had to call in sick from work because I was just tired or fatigued, and these are all causes of health that, shouldn't be ignored. A lot of times we think about health in terms of, I didn't go to the doctor, I didn't take medicine, I didn't use my paid time off to take care of that flu, but health is more than just that. I want to talk to you a little bit about social determinants of health. What is it that makes us healthy? Is it just our biology and genes, differences in gender? For example, my husband works out every Monday, Wednesday, and is he healthier than me, who goes to the gym maybe twice a month? Probably so, because when we have a cold, he gets better faster than I do. So his individual behavior of getting the exercise regularly is affecting his health as compared to me. So in addition to the biological differences and those individual behaviors, health is created in the community through physical, social, economic, and environmental factors. And these are collectively called social determinants of health. And these include conditions where people are born, where they live, they work, they play, they worship. For example, I have a coworker. She's a white taller woman, and I'm a shorter black woman, and we have differences. Obviously, where I grew up is different from where she grew up. My environment is different from hers, so definitely her health is going to be different from mine because the money we make could be different. Our homes are different. If I live in a safer environment compared to her, or if she doesn't compared to me, how we can get emergency health services if we have access to that. These are all things that come into place to make us healthy or not, and those are the social determinants of health. So why excuse me, why are these a big deal? In public health, social determinants of health are a big deal because everyone has a right to health. Whether you're Latina or Muslim or gay, you have no money, you have a lot of money, everyone has a right to health. So when we have differences in disease outcomes, we say that we have disparities. Disparities can not be avoided. For example, breast cancer is more in women than men, obviously, because women have breasts. The biology is different. But when you have health issues because of systemic, systems, government, environment, whatnot, that can be avoided, and they're called health inequities. So in that same example of breast cancer, Black women die from breast cancer more compared to white women. And this is because they have less screening. They probably have different relationships with their doctors, maybe less health insurance. So these are systemic, and that's why they're called health inequities. These are other examples that I put up together on social determinants of health. These are those unfair situations that affect our health. So when you live in areas with heavy waste and pollution, you have high asthma rates. Discrimination in housing, for example, lending, renting, can lead to housing problems. Individual behaviors can lead to poor health habits, no access to healthcare, segregation, lack of education, low income. There's a lot of different social determinants of health. And that's it. Any questions? No? Awesome. Thank you.